Welcome back. Well, a panel of former CDC workers and leaders, they sounded off at the state capitol today, and they were decrying the Trump administration's approach to public health as flu season looms.
11 Alive's Doug Richards reports that they are troubled by the Trump administration's approach to public health.
Change happens every administration. We're used to that.
Dr. Deb Howry told state lawmakers the first Trump administration competently handled the 2020 COVID vaccine rollout. The second administration has been a bit different.
What I was not ready for was to have decisions made not based on data and science.
Howry resigned from her position as CDC Deputy Director and Chief Medical Officer a few days ago after weeks of tumult at the CDC, concluding with hundreds of rounds of gunfire outside CDC headquarters last month from a man reportedly angry over his own COVID vaccine.
And we're asking that science go first before the policy development and not starting with an ideology and then backing into the science.
Dr. Dan Jernigan worked 31 years in public health before he left the CDC last month, where he led the National Center for Emerging and Zoonotic Infectious Diseases. He says that under the direction of HHS Secretary Robert Kennedy Jr., the agency has taken a troubling turn.
I feel that they can make it through, but I can't tell right now, given all the cuts to staffing, the cuts to resources, and the undercutting of science.
Dr. Jernigan says Americans can be safer if Kennedy can shift his priorities to get behind legitimate medical science. Doug Richards, 11 Alive News.
Dr. Howry said the CDC is now past the time when it would normally issue guidance for flu and COVID vaccines for the fall.